I'm a vascular surgeon. I've always known that I wanted to do something surgical. I enjoy working with my hands and seeing the immediate results of the interventions and the things that we can do to help patients. What attracted me to vascular surgery is that the disease processes. We deal with a lot of diabetes and atherosclerosis, which is hardening of the arteries. We get to help patients of all kinds, of all ages, with both arteries and veins, and we get to operate all over the body. I like to describe my approach to patient care as tailored to every individual patient. Different patients have different needs, and they have different goals in life. So the approach that we take to a patient's care and to their surgical planning and disease treatment really has to fit into what's going on with them and the totality of their life and their family situation. I think the most important thing that we focus on in our office is to make sure that the patients feel heard and seen. Whereas in our office, we try to make sure that the patient receives all of the time that they need to make sure that their concerns are addressed. I think one of the most rewarding things about being a surgeon and being a physician is when the patients come back and follow up with big smiles on their faces after we've worked hard to save their legs or treat aneurysms or really address life-threatening diseases, and they come back feeling great and back into their routine and their life. That's really one of the most rewarding things.